Hi, my name is Mary Morris. I'm a reproductive endocrinologist and a fertility specialist at Boston IVF. I work out of primarily the Stoneham office, but I'm also in the Waltham office. I went to Columbia to med school in New York, and then I moved to Boston and did my residency between the Brigham and the MGH in OBGYN. And then I did my fellowship training at Mass General Hospital in Boston. So my approach to patient care is that the patient is the center. It's about them. It's not about me ever. The first couple of minutes, I like for them just to reflect with me why they're here and what their goals are. I like to learn about them as a person. I generally, if they already have children, I want to know their children's names and dates of birth. I like to hear about their dogs and cats and their pets and their families, where they're from, if they're part of a couple. I like to find out about how they met each other. There are a lot of people who've inspired me, a lot of people who have helped in my training and who have sort of guided me along the way, but in reality, my biggest inspiration comes from my patients. So many of my patients inspire me because they go through an awfully lot to get to their dream of having a healthy baby or freezing their eggs or whatever their goals are. Just coming in to see a reproductive endocrinologist or an infertility specialist is really, really difficult. I acknowledge that. And I try to acknowledge that with you in your first visit. Getting the testing done can be incredibly confusing. And there are lots of people on the team who are going to see you through that and make sure that you've gotten everything done and that you're never lost. At follow-up visits, I just want to make sure that you understand everything and that you understand all of your options, and that we find a treatment plan that works for you. For some people, that's just taking a little more time. For other people, it's about doing sort of the first steps of, say, like an IUI, if that would be helpful. Other people, it's going to be a more detailed plan. Your decision-making is at the center of our decisions. When you're going through this process, don't forget about the small stuff. Like, it sounds like small stuff, but it's actually the big stuff, like taking your prenatal vitamin and getting adequate sleep and taking care of yourself. And also remembering to live your life. I know people who've missed birthday parties and baptisms, and bar mitzvahs and weddings and funerals. And I think it's just really important to remember to live your life in the midst of getting all this stuff done.